Welcome to Modern Management of the Older Adult, brought to you by the Institute of Clinical Excellence.
Welcome to the MMA podcast, the podcast dedicated to all things older adult. My name is Anushka Raja, and I'm a TA with the Older Adult Division of the Institute of Clinical Excellence. Today, we're diving into an article titled Exploration of Combined Physical Activity and Music for Patients with Alzheimer's Disease, a Systematic Review. We just wrapped up week 7 of Older Adult Level 2, which is our week on cognition, and a student had asked about research specifically around music and physical therapy interventions with patients with dementia, because she had a patient with dementia whom she administered a standard 6-minute walk test with, followed by a modified 6-minute walk test where she was playing music. And what she found is that the patient did significantly better with that music playing. So we're going to dive a little bit into the systematic review. Therapists are constantly looking for safe, accessible, and salient interventions that can help improve patients' quality of life, slow cognition, and slow cognitive decline, and reduce behavioral symptoms. And we know that both physical activity and music therapy, when used separately, have proven benefits within this demographic. Physical activity can include anything from walking to resistance exercise to high-intensity interval training. And we know that that is all proven to improve people with Alzheimer's disease physical performance, enhance their ability to perform daily activities, and help slow overall rate of cognitive decline. It's just simply good for the brain and the body. And then we also know similarly that music therapy has long been used because musical memory is often one of the most preserved cognitive functions in Alzheimer's patients. Whether it's listening to familiar songs or actively singing, music can boost mood, reduce anxiety and depression, and improve orientation and memory. So the real question here is, what happens when you combine the two? So this particular systematic review set out to provide a definitive answer. Researchers searched medical databases for studies published between 2002 and 2022, specifically looking for randomized controlled trials that combine physical activity and music intervention. Out of the 200 potential relevant studies, they only used 8 high-quality studies that's because that's all that met their strict inclusion criteria. So that does tell us that there's not a ton of research on this and definitely room for more growth with it, but gives us something to start off. So what did this combined data reveal? The review found that combined physical activity and music intervention produce considerable and clinically relevant benefits for patients with Alzheimer's disease. And the 4 areas of improvement include cognitive motor function, physiological benefits, and psychological well-being. For cognitive and motor function, the combination was notably effective in improving psychomotor speed and the specific aspects of memory. In essence, combining the mental task of listening to or engaging with music while performing physical tasks acts kind of as a dual task training for this population, which we know research shows time and time again that dual task training improves both physical and cognitive benefits versus just physical activity alone. And it forces the brain to process 2 simultaneous inputs, therefore stimulating and strengthening neural pathways, which is so helpful. Physiological benefits include it improved heart rates, improved their ability to regulate motor patterns. This suggests the intervention is making a measurable and positive impact at the biological level. And then for psychological well-being, similar to music therapy alone, the combined approach helps patients with mild to moderate dementia reduce anxiety, restlessness, irritability, and aggression. The enjoyment of music makes the exercise sessions less taxing and more engaging, lowering a patient's perceived effort, which is critical for adherence, especially within this population. A big thing I will hear from caregivers is that it's basically impossible to get them to do a home exercise program or guide them through it because they can become agitated or just don't want to engage. So again, music therapy might help if you add that in with the physical activity itself. The review also highlights an important nuance that the effectiveness depends on the dose of the intervention. Some of the reviewed studies that used a low frequency approach, like one short session a week, did not see a significant change in cognitive performance. However, studies with greater frequency and duration, such as like twice a week for up to an hour a session, reported the clearest improvements in cognitive, psychological, and motor abilities. This points to one of the central challenges in this research, a lack of consensus, because studies included various types of exercise like Tai Chi, calisthenics, simple walking, resistance exercise, and then different types of music interventions, including singing, passive listening to nostalgic music. So there's no exact protocol that all of them followed, but that just shows us that we need more research on this area in order to create a more standardized intervention protocol, remembering that everything's going to be individual to your patient, but something that might help define optimal frequency, intensity, and duration so that the combined music and movement programs can be more widely adopted in clinical guidelines and therapeutic practice. So what's the big takeaway for clinicians, families, caregivers, whoever's involved in their care? This systematic review strongly supports the idea that deliberate combination of physical activity and music should be considered when working with people with Alzheimer's disease or dementia. One thing I have about this is I had a patient who he was pretty far progressed with his dementia, and the only way I can get him to do cardio or just get really good aerobic exercise was playing music. I'd let him choose a band, so it's always something from like the 50s or 60s, but he'd have a smile on his face and we'd like be able to pump 2 steps per minute on the new step, versus if I just had him try the new step on its own, he would go very slowly, like that cruise control. So it was a good way to pump up the activity for him and bring intensity for him while maintaining salience, because he enjoyed it more with that music. But just food for thought when you're looking at this with these patients. If you haven't taken level 1 and would like to learn, if you have taken level 1 and would like to learn more about working with people with cognitive decline or other special populations or considerations, our next cohort of older adult level 2 starts on February 9th. If you have not taken level 1 yet, the next cohort starts on January 14th. They're currently in a cohort as well. If you want to connect with us live, we have courses in Georgetown, Kentucky, which will be this coming weekend. We will have one in Bozeman, Montana, November 22nd to 23rd, and then we'll be in Kingston, Ontario, December 6th to 7th. That is all I have for you tonight. Thank you for listening, and I hope to connect with you soon.
Thank you for listening to the MMOA podcast. If you found this helpful, please share with someone that could benefit. And if you're looking for more practical content to help you better serve older adults, head over to www.mmoa.online, where you can learn more about our free resources, our community, continuing education courses, and our certification. Once again, that's www.mmoa.online. Thanks for listening.